Hi, Sonia Liebendorfer here. We're going to be continuing our study on the different types of amyloidosis. And this week we are going to be covering the AA type, which is considered to be the secondary type. And we are going to be going into it as well as the types of cancers that it causes as well. All right, AA amyloidosis, or secondary amyloidosis, they call it, is an abnormal deposition of a serum amyloid A protein. So you'll hear this often referred to as the SAA, serum amyloid A protein, which is normally soluble. But for whatever reason, in this particular condition, it starts to deposit in the tissues and in the organs. Now, the serum amyloid A protein, the SSA protein that is the causative factor in this, it's considered to be an acute phase protein because the plasma concentration for this particular protein is highest when there is inflammation. Now, this particular type of amyloidosis is a complication of a number of inflammatory diseases and infections. And what they have found is that a small portion of people that have these conditions go on to develop this type of amyloidosis. Not everyone, just a certain portion of patients. So it's interesting to note that this type of amyloidosis shows up after several years of battling an inflammatory condition or an infection. This isn't something that shows up right away. This is an insult that has happened to the body over time that it has developed a difficult time in dealing with, and things can go awry in this certain portion of patients that get this. Now, the most common presentation of this type of amyloidosis is kidney problems. They start spilling protein in their urine, and this shows up on just a regular checkup, or perhaps their amount that they're urinating is dropping off. They develop something called a nephrotic syndrome, where they start getting the big proteins that are blocking the urine output. Then that becomes a problem to the point that they have to end up being put on dialysis or have to have a kidney transplant. But oftentimes, this type of amyloidosis doesn't show up until there's some kind of kidney event that occurs. Now, there are several autoimmune diseases that are associated with this particular type of amyloidosis. They associate rheumatoid arthritis with it, which also includes juvenile arthritis, and the spondylitis, it's the bone spur type arthritis. And they also have found psoriatic arthritis has something to do with this form of amyloidosis. And since we're talking autoimmune, even though it is not mentioned here, I saw it mentioned in some other research that they also consider the systemic form of lupus to also be considered in this grouping of autoimmune diseases. Even though in this particular list on this research, it was not listed, I did see it listed in other places. Now, some autoimmune diseases of the gut that are associated with this type of amyloidosis are Crohn's disease and ulcerative colitis. And there's some medical conditions that can be associated with it that are autoinflammatory that are rare that I've never heard before in all my years of doing this, and I've been in the medical field since 1996. But there's some medical conditions that are associated with this that can cause this type of amyloidosis. And of course, these are going to be worthy of their own presentation since I've never heard of them before and I'm not familiar with them. But familial Mediterranean fever is one of those that causes that, as well as Muckle-Wells syndrome and the tumor necrosis factor receptor associated periodic syndrome. These syndromes I am not familiar with. In all my time that I've been a nurse, I have never heard these conditions mentioned before. But these are autoinflammatory diseases that are associated with this type of amyloidosis. So these are three conditions that I'm going to be doing separate presentations on because I've never heard of them myself. So of course I'm going to do some digging and learn about them and then teach y'all about exactly what they're all about as well. Now, we said that there's some cancers that are caused by this particular type of amyloidosis, so I want to go into those. First of all, there's Hodgkin's lymphoma that is caused by this particular type. Then there's also renal cell carcinoma. And then there is Castleman's disease, which was named after a Dr. Castleman. This is another one that's new on me. But I happened to look it up, and it's something that can develop into lymphoma, even though it only attacks usually one lymph node. For whatever reason, it just starts growing haywire, but it normally doesn't affect more than one lymph node. So they normally can just take care of it with surgery, but it can develop into lymphoma. So when that is the case, that's why I listed it here with the other types of cancers that it can cause. All right, and there are some chronic infections that are associated with this type of amyloidosis. The first of which is tuberculosis, the second of which is bronchiectasis, and the third of which is chronic osteomyelitis, which is a chronic infection of the bone. And that usually happens whenever there is a toe amputation or something in a diabetic and the infection gets to the bone and they have to end up taking the bone too. Sometimes if that infection is not gotten under control, then they just end up cutting more and more and more. So this type of chronic osteomyelitis or infection of the bone can cause this type of amyloidosis. Now, there are some infections that are associated with chronic conditions that we need to focus on that can be a cause of this type of amyloidosis. The infections associated with cystic fibrosis, AIDS, or drug addiction that causes skin infections that are recurring. Those type illnesses can also cause amyloidosis. All right, so we already talked about how somebody that goes to the doctor can be complaining about decreased urinary output, or they start having protein in their urine that shows up on the urine dipstick test. But if they don't complain of those two things, then the other thing that can show that there is a problem is if they have swelling of the legs and the ankles. Now, how is that a symptom of this? Well, if they start spilling more protein than what they have in the blood, then there's not going to be enough albumin protein in the blood to hold on to some of that moisture. So all of that is going to leak out into the tissues instead of staying in the vascular area where it belongs. So whenever you start seeing people that have low albumin levels in their blood, that's what causes all of the excess swelling in the ankles and the legs that you see when they're spilling a lot of protein in their urine and they don't have enough in their vasculature to hold on to all the extra fluid. It just leaks out into the tissues. And it actually can get to a point that if the swelling is not resolved, it can cause an actual weeping of the skin. I saw that a lot in the ICU setting. the skin actually weeps and has this syrupy type liquid come out of it over a period of time if you don't get swelling like this under control. Another thing that it causes is high cholesterol. When this starts to affect the liver, there can be enlargement of the liver, and you can start to have cholesterol issues with these patients as well that show up on lab work. All right, now as we said, you can have an enlarged liver with this. That, as well as enlarged spleen and an enlarged thyroid, those can all be palpated by a physician whenever they're doing a physical assessment in the office. They can palpate for the edges of the organ and see if there is any enlargement felt by them, and then order any further testing that they deem necessary to determine if there is a problem there. In addition, a problem that may present is a patient comes in stating that they get dizzy when they stand up. If they're complaining of dizziness when they stand up, it's called orthostatic hypotension, which means the blood pressure drops and changes drastically with any change in position when going from a sitting to a standing position, and that's why they get lightheaded. Also, there can be a slowing of gastric emptying. Person may come in complaining of having a feeling of really having a lot of bloatedness and fullness after they eat for a long period of time, and it's because the gut is taking its sweet time in slowing down. And it could also be from the organ enlargement that they have this feeling of fullness and feeling of bloatedness. So it is important that they determine the exact cause. Now, some other symptoms that they may present with is they've started having diarrhea in their stools, and they don't normally have diarrhea, but all of a sudden it's hitting them out of the blue. Or they're having problems with constipation out of the blue. All these can also be concerns for colon cancer and those types of things. So we want to make sure that we take these complaints into consideration with any other illness that they have going on. This also can be bleeding, can be a sign. And that is especially concerning whenever it involves either diarrhea or constipation that are not common in a particular patient, because this too can be a sign of colon cancer and a reason to warrant further investigation. Now, we know with bleeding, you're looking for something that is really dark in color, that is a maroon color, to be associated with any problems in the stomach itself. As the problem is later on in the system, then that blood is going to become a brighter problem. Now, bright red blood in the stool is going to be indicative, most likely, of some kind of internal hemorrhoid or something that the person doesn't know that they have. So you have to be concerned about how much bleeding they're doing when they go to the bathroom, and also the color of it. Is it dark in color, meaning it's higher up in the stomach, in the gut, causing the problem? Or is it a brighter blood? Because that means it's closer to the end of things and may have to do with hemorrhoids. Another thing that you have to be concerned about is new onset of arrhythmias, which can be an indicator that this is attacking the heart muscle. So you have to be concerned with arrhythmias also being a cause of somebody who has orthostatic hypotension and their blood pressure drops when they stand up, because their body doesn't have a chance to respond physically due to whatever is going on. So if they're starting to have problems with arrhythmias, you're going to see more and more complaints of dizziness. You're going to see more and more complaints of volatility with blood pressures. So just keep that in mind. Another thing that becomes a concern is congestive heart failure, because as these vegetations affect the heart, they're going to affect its ability to beat. We talked about with the AL amyloidosis how it can affect the heart by stiffening it. So the same thing is true with this particular type of amyloidosis. It can cause the stiffening of the heart muscle and make it more difficult for it to beat. So that causes issues with congestive heart failure over time as these arrhythmias present themselves if they're not treated in a timely fashion. Another thing that you can look for in this particular type of amyloidosis, as in the AL type, is excessive bubbles in the urine. We talked about that in the AL amyloidosis, how that was a sign, and that same sign is also present in the urine, can be present in the urine for these patients as well. Basically, as doctors and care practitioners, whenever they see these people with these particular complaints come into the office of weight loss that's unexplained, or weakness that's unexplained, or some kind of new onset of swelling, these things are often missed as being early signs of amyloidosis because for whatever reason they just attribute them to whatever inflammatory or infectious disease process is going on that is chronic in nature and has happened over time, and they dismiss it as that and don't really dig into this as being a cause of amyloidosis for that person. And because of that, treatment can be delayed. And it's important that treatment is not delayed and the appropriate diagnosis is done. And sometimes you have to push them to get that done. But it's important to get it done because there is no cure for this type of amyloidosis. The only thing that you can do is control the symptoms. So the earlier that you get the symptoms under control, that these proteins are building up, the better off that you're going to be. So these particular things are things that physicians miss and can just attribute it to a previous illness type that you have. So make sure that you hold them accountable for what they need to check for, because they don't always do it if they're not prompted to. So just keep that in mind. So a lot of times these patients will present with having protein in their urine. After years of having either an inflammatory disease or an infection, all of a sudden they go to the doctor for one of the above reasons, or because their urinary output has dropped off and they don't know what's going on, but they know something's up because they just have been feeling a little bit off. And they've just noticed all of a sudden their urine drops off and they're not peeing as much, and then they notice that their ankles are starting to swell and they're like, okay, something's amiss. Maybe they're having some urinary tract infection symptoms, start having some burning. They're like, okay, something's up, I need to go to the doctor, get checked out. So they do a urine dip and they check the urine with the dipstick and it comes back high protein. So they want to do further investigation. So what they'll do is they'll do a 24-hour urine collection to see just how much protein the person's losing. And we said before, some doctors prefer to do a 24-hour collection with you in the hospital, because that way they know that none of it's getting spilled, none of it's getting emptied. They'd rather have you on that call bell whenever you have to go so they get an accurate count than, miss up the count with you accidentally forgetting to collect a specimen or whatever. So a lot of that is up to the physician's discretion, whether they want to keep you in the hospital for that 24-hour collection or if they trust you to do it at home on your own and just empty it into the big jug and then have you tote that back to their office or turn it into the lab, whichever way they do it. But it can be done either way. But usually I've seen this done in the hospital setting just because the physician wants to make sure that they have an accurate number. Now, once they actually determine that there's issues going on with the kidney, what they normally do after that is they'll do a renal biopsy. And they do that to make sure they get the actual diagnosis because they use what's called a Congo red staining in the lab. And if these particular proteins are present that cause this particular type of amyloidosis, then it's going to cause a green apple color under the microscope. If they're not present, then it's not going to change color. So they like to do the biopsy to make sure they get an accurate diagnosis as to which type of amyloidosis that they're dealing with. Now, obviously, with the AA type, if you have an underlying rheumatoid arthritis or some type of autoimmune disease, such as lupus or something that can attack different organs of the body, you definitely are more at risk for getting this type of amyloidosis than any of the other types. So this is the one that they would be testing for if they know that you have a problem that's ongoing with a different type of inflammatory or infectious process. Now, as I said before, if they have an underlying inflammatory infection or an inflammatory illness that has not been identified as causing this, then we have to backtrack and do the testing to determine exactly what condition they've been dealing with for several years that threw them into this type of amyloidosis, because this is a secondary problem, and that's why one of the reasons that it's called secondary is because this isn't an initial injury. This happens after you've had a condition for several years. It can't something that can develop, not in everyone, but just in a certain portion of people that get an illness or an infection that's chronic. So we have to go back and find out what the cause is if we don't know what it is. So hopefully there's a diagnosis before this that we know what the problem is and what's causing the amyloidosis. Otherwise, we have to go back and do all the initial testing and digging to try to find out what chronic condition this poor person has that they didn't know that they had. And that would be awful, because then you not only find out you have one condition that you have to deal with, you're finding about one you didn't even know that you had. So that's just a double whammy emotionally to have to deal with. Now we're going to go into some of the different treatments for these. And one of the interesting things about this familial Mediterranean fever, there is an anti-gout medicine called colchicine that they have found is an effective treatment and a preventative medication for this familial Mediterranean fever that for people that have amyloidosis. I find that just fascinating that they can use a drug for a totally different problem to use as a preventative medication for this particular type of illness. So that is something that's very promising for them. Now, they do use biologics in certain cases for tumor necrosis factor and interleukins that can be used to reduce the risk and treat active amyloidosis related to autoimmune and rheumatic disorders. So they have found that the biologics that they have used for rheumatic fever and for different autoimmune diseases, such as the Crohn's and the ulcerative colitis, have actually found to been beneficial in using to reduce the risk in this particular type of amyloidosis as well. Now, the key to really getting this under control is early treatment. So we have found with this particular type of amyloidosis that it will slowly regress with the appropriate treatment of inflammation for Crohn's, ulcerative colitis, and rheumatoid arthritis, because they have numerous treatment options available to them. But if you don't get the underlying cause of it under control, then it will expedite demise. And so it is important to make sure that this gets under control, because if you don't, then it affects your longevity and you will not live as long. So this is important because there is no cure that it is managed properly. Now, new therapies that they have currently in research and development, they're looking at having medications to help bind and clear the amyloid fibrils that are in the blood that haven't deposited yet. And they're also looking at making antibodies that will target and clear the deposits that have already been made in the organs. And these are future treatments. These have not been mastered yet. That's why it is so important to be willing to participate in clinical studies whenever they present themselves, to have an opportunity to help them find treatments that will work for this particular type illness. Because if we can find a way to reverse the damage that's already been done, that is going to be the key measure in getting these processes to resolve in the future. Because right now we can treat them and prevent them from getting worse, but we don't have any way of getting them to actually reverse themselves once it's already been deposited into the tissues. All right, so what are we going to do with somebody that develops Hodgkin's lymphoma from this? They're going to get chemotherapy, and they recommend a combination approach. They recommend chemotherapy and radiation, both, to take care of it. And then if they have stubborn cases of it, then they do bone marrow transplants to help with it. But they are thinking that in the best interest of making sure that it is taken care of totally, to do a combination treatment with chemo and radiation is the best alternative. Now, for renal cell carcinoma, the most often they just take out the kidney, because you can be fully functional with just one kidney. For whatever reason, if the other kidney, they're worried about the other kidney developing the same problem, which it normally does not. But if they're worried about the other kidney because of problems being anticipated with the function of that kidney, then what they can do is go ahead and put the person on a transplant list for a kidney replacement, and then replace the kidney once it becomes available. But these are the options that you have for somebody that has the renal carcinoma. All right, and we talked about how Castlemans was actually named after a physician about for a type of lymph node that for whatever reason just overgrows like crazy. But it puts a person more at risk for Hodgkin's lymphoma and the other lymphomas. So this is treated by surgical resection because it normally only involves one lymph node. If it involves more than one, then they get more suspicious for it being a lymphoma being involved. But in ordinary circumstances, it's only one lymph node that's affected. Now, the catchy thing is the lymph node that's affected is usually in the chest or in the stomach. And those lymph areas most of the time don't get caught right away. It's usually something that is difficult to catch unless it is caught on some type of scan. So be advised that this particular type may be difficult for a physician to catch or to diagnose. So it is important that they do the appropriate screening, because it may only show up on some type of scan. It can show up on the scan of the chest, or it can show up in a scan of the gut. But soft tissues, you will probably have to have contrast to make it show up. So you would need to make sure that that person does not have an allergy to contrast media when the scan is being done. All right. I want to thank you for being here today. I know there's many other places and many other things you could have been spending your time doing, but I appreciate you being here and learning about this particular type of amyloidosis. Please like and subscribe if you haven't already, if you learned something today. And you can email me, and I put my email address here for you to email me with any questions that you have. Just make sure that you put something in the subject line that's going to snag my attention, because I go delete crazy with my emails because I get so much junk mail. So just email me if you have a question. I'll be more than happy to answer it for you. Want to give a special shout out again to Wikipedia, to the Amyloidosis Foundation, and to the Cleveland Clinic for the information and the pictures that they had available for this presentation, because they do an awesome job in providing information to families that end up being diagnosed with these particular problems to give them the supportive help that they need. Y'all have a great week. I'll be posting the sales they have from Stop Aging Now and for the CBD products. When I get them, they will be coming out later this week, closer to Halloween. So look for those. Otherwise, I'll be giving y'all the next presentation next week. Have a good one. Y'all take care. Bye.